worry about in terms of an isolated school of medicine is that if people talk about just training doctors, they're not necessarily talking about community health. They're not talking about enhancing the well-being of the community. It's a component, but it's not enough. So we have to somehow find a way to broaden the perspective or the role of what the school does if for some reason we had our public health element amputated. It just, it worries me because I don't like that thought. I think physicians as part of the health system have to be more global in their thoughts. Community needs to hear about healthy choices, and we need to have all health professionals talking the same language and aware of what those choices need to be. This community focus I mentioned, systems approaches. I can't tell you how I worry about emergency medicine, my own field, becoming insular and thinking only in terms of when the patient comes to the emergency door, that's when we begin to provide care. We've got to think more in terms of not only how do we help at the time an emergency takes place, but how do we prevent emergencies in the community, and how do we get systems in place that make sure that that right patient gets to the right place at the right time. The global interactivity and global ecology is important. So I wanted to just kind of conclude on a few things that from my perspective, and one of the reasons I'm here today, is I see public health as a key part of what the John A. Burns School of Medicine is doing. I see it as important because of our commitment to the community and because you can't create health by looking only at what the physician does. The physician has to be part of a larger system and program. And we have to train physicians, as we train other health professionals, to see themselves as part of that larger team. I think we have tremendous shared values with public health in terms of what we're trying to achieve. We truly want to assure that we're looking for the health of the community in a more global role as we look forward. We truly have significant overlapping knowledge, and our curricula actually have a lot of complementary elements. And health services research is a key part of what we're trying to achieve out of the John A. Burns. We just this week completed, along with the help of many on campus and in the community, an application to the Clinical Translational Science Award process that the NIH is sponsoring, the NCRR component. This will be a major initiative that will tie together a lot of the T2 efforts that are ongoing in our community, and it will help provide some synergy in these programs. So this health services research that would be possible through such a grant is really key to what the school as a whole is trying to achieve. So I think in terms of strategic planning, we have some opportunity to evaluate what we're doing across our missions. We can achieve some enhanced operational efficiencies in terms of looking at our educational programs and how we can blend those. And if we can achieve some geographic proximity, I think we can strengthen those. And I think also, as we, and I'm glad that Tina Shelton's here, our Director of Communications for the School of Medicine as a whole, because she's been working with Jay and others in public health to emphasize what aspects and programs public health's been doing. And we're trying to get the word out there. What does the School of Medicine offer the community in the broad sense? And it's really important that our public health components are emphasized. Make the community aware. And I think the more that we're linked together in our efforts, the more of a positive feeling our community will have about our collective programs. This gives us some enhanced legislative and institutional stability that I think will help us, especially in some trying economic times. And as Jay knows, as we become more visible, some opportunities for some philanthropic support exist and evolve. And it's part of my goal to make that happen across the school in the larger sense. So a lot of some of the philanthropic opportunities will fall to our public health efforts because those resonate well with people in the community, and that's something we're trying to emphasize and build upon. So I think we'd like to change the paradigm from being siloed entities to as much to bringing ourselves into alignment. we need a strong public health focus as part of what the medical school is doing. I think that public health is a key discipline within the medical school, and that we want to embrace this greater breadth within the medical school as a foundation for public health. Whether it be emerged as a separate school or whether it be emerged as a combined entity, which is kind of the perspective that I have at this time, I think is in the future, and it's something that we're not going to decide today. But I did want to raise that issue and talk about some of the focus areas that I think the medical school's been working on as a whole, on how they complement what you've been doing within our public health programs. So again, all politics are local. You're about to hear the rebuttal. And I guess, should I wait on the questions until the
Yeah, we're going to have everyone speak, and then we'll open up the floor.
Okay, we'll do that.
Thank you very much, Dean Hedges. Our next speaker is going to be Denise Nelson. Denise is a second-year public health student working on her MS in epidemiology, and she also serves as vice chair of our student group, the Hui Olopono. So, Denise.
Thank you all for coming. I'm sorry I don't have a beautiful PowerPoint like Dean Hedges. There are just a few things that I wanted to touch on, and thank you for that wonderful presentation. I think you bring up a lot of very interesting points and a lot of things that we really need to work on, both from public health and from a medicine perspective. And the synergy sounds like a wonderful idea. And building bridges, and I once heard that the world has problems and the universities have departments, and I'd really like to see that fixed up a little. My perspective about the School of Public Health, if we could just jump right into that to start with, I think that we could be a stronger entity, separate but working together. I think you mentioned earlier that public health can serve as the glue for a lot of different disciplines, including ecology and economics, and I'm an economist by training, so I totally get your point. And I think that public health can do a very good job of that as its own entity, and even a stronger support system as an equal partner rather than as a subset of medicine. But I think it's wonderful that you're trying to incorporate public health into medicine. There's a lot of things that could be learned from both sides. And like you said, public health is a big part of medicine. We do want to, there are a lot of overlapping areas that we should be looking at. Creating synergy. Sorry, I'm not used to the whole format of this. Okay.